Welcome to episode 18 of The Pulse of Physiology. I'm your host, Dr. Jim Davis, and today's episode is dedicated to exploring the autonomic nervous system, or ANS, and this is one of my favorite topics of physiology. The autonomic nervous system is critical for maintaining homeostasis, governing involuntary processes like heart rate, digestion, and respiration. Since we'll cover 3 detailed PowerPoints, this episode will be longer than usual. In our next episode, we'll shift gears to discuss sensory receptors and the special senses. But for now, let's jump into the autonomic nervous system. So to start off, the autonomic nervous system is a subdivision of the nervous system primarily responsible for regulating involuntary functions. It has 2 primary divisions. The sympathetic nervous system, abbreviated as SNS, is known as the fight-or-flight system. It prepares the body for action by increasing heart rate and redirecting blood flow to muscles, dilating airways, and releasing energy stores. Then we have the parasympathetic nervous system, abbreviated PNS. The parasympathetic nervous system is dubbed as the rest and digest system. It conserves energy by slowing the heart rate, enhancing digestion, constricting airways, and promoting relaxation. Both of these divisions work together to maintain a dynamic balance, or homeostasis, with one system predominating depending on the situation. This balance is referred to as tone, with sympathetic nervous system tone dominating during high activity and parasympathetic nervous system tone prevailing during rest. Now, the autonomic nervous system operates through efferent pathways that include 2 neurons. You have a preganglionic and a postganglionic neuron. Preganglionic neurons originate in the central nervous system and synapse with the second neuron in an autonomic ganglion. The postganglionic neuron extends from the ganglion, going to the target organ. Now, the anatomy of these 2 is similar in many respects, but it's also different. So, the sympathetic nervous system has its anatomy. So, the preganglionic neurons are short, they're myelinated, and they release acetylcholine to activate nicotinic cholinergic receptors in the ganglia. The postganglionic neurons, on the other hand, are long, unmyelinated, and typically release norepinephrine to activate adrenergic receptors. Now, there are some exceptions to this pathway, and they include postganglionic neurons that release acetylcholine in pathways targeting sweat glands and blood vessels in skeletal muscle. The parasympathetic nervous system anatomy is similar with the preganglionic neurons. They're myelinated, they release acetylcholine to activate nicotinic cholinergic receptors. However, unlike the sympathetic nervous system, which has short preganglionic neurons, the parasympathetic nervous system has long preganglionic neurons. When it comes to the postganglionic neurons, in the parasympathetic nervous system, they're almost the opposite of those found in the sympathetic nervous system. These neurons are short and unmyelinated. They release acetylcholine to activate muscarinic cholinergic receptors on their target organs. So if we compare the postganglionic neurons between the sympathetic and parasympathetic nervous systems, the only similarity is that they're both unmyelinated. Now, ultimately, the effects of the sympathetic and parasympathetic nervous system activation differ based on the target organ. In the heart, sympathetic nervous system increases heart rate and contractility by activating beta adrenergic receptors, while the parasympathetic nervous system slows heart rate down via muscarinic cholinergic receptors. In the lungs, the sympathetic nervous system dilates airways by activating beta receptors, whereas the parasympathetic nervous system constricts airways through muscarinic receptors. In the digestive system, the sympathetic nervous system reduces digestive activity by decreasing blood flow and motility, or movement of the substances through the digestive system. Conversely, the parasympathetic nervous system enhances digestion by increasing secretion and motility. When it comes to sweating, the sympathetic nervous system causes sweating via those cholinergic pathways discussed earlier, and the parasympathetic nervous system has no direct effect. Additionally, the sympathetic nervous system affects the adrenal gland. The adrenal medulla, which is the middle of the adrenal gland, acts as an extension of the sympathetic nervous system. Preganglionic neurons directly innervate chromaffin cells in the adrenal medulla, and these release epinephrine and norepinephrine into the bloodstream. This creates a systemic fight or flight response, amplifying and prolonging sympathetic effects throughout the body. Visceral reflex arcs regulate internal organ function without conscious input. These reflexes are similar to those that we talked about with the somatic reflexes, but they target smooth muscle, cardiac muscle, or glands. Their key components include sensory receptors, which detect changes in the internal environment, such as blood pressure or oxygen content, afferent pathways, which transmit sensory signals to the central nervous system, the integration center, which is usually or often the spinal cord or brainstem, and then efferent pathways, which carry motor signals to effectors. The effectors ultimately execute the reflex response, such as altering heart rate or releasing hormones. Examples of visceral reflexes include changes in heart rate in response to blood pressure, which is known as the baroreceptor reflex, or insulin release in response to high blood glucose. What's really interesting is that the response time varies between these two systems. The sympathetic nervous system tends to take longer to respond due to the release of epinephrine into the bloodstream, and so that takes a while for epinephrine to get to its target. But what also happens as a result of this is that so much epinephrine is released into the bloodstream, it takes a longer period of time to clear out. And so as a result, the effects of the sympathetic nervous system tend to last longer. The parasympathetic nervous system, on the other hand, is faster acting due to the direct action of long myelinated preganglionic neurons and the absence of circulating hormones. Understanding the autonomic nervous system is essential for managing various medical conditions. For example, we have beta blockers. They target beta-1 receptors in the heart to lower blood pressure and reduce cardiac workload. Asthma medications such as beta-2 agonists like albuterol relax bronchial smooth muscle, which makes breathing easier. And then we've got cholinergic drugs that enhance parasympathetic activity, and these are often used in treating things such as dry mouth or glaucoma. So let's wrap up with our key takeaways, and there are 4 of them. First, the autonomic nervous system consists of the sympathetic and parasympathetic divisions, each with distinct anatomical and functional characteristics. The sympathetic nervous system prepares the body for action, while the parasympathetic nervous system promotes relaxation and energy conservation. The adrenal medulla amplifies sympathetic responses by releasing epinephrine and norepinephrine into the bloodstream. Visceral arcs maintain homeostasis through rapid involuntary responses. And so that's it with episode 18 of the Pulse of Physiology. I hope this expanded exploration of the autonomic nervous system has deepened your understanding and its critical role in maintaining homeostasis. Join me next time for episode 19, where we'll begin our exploration of the special senses, starting with sensory receptors. Until then, keep questioning, keep exploring, and stay curious.